Oh. No, I don't know.
Gada, did you want us to begin?
Yes, please.
Okay.
So I've given Lisa the privileges so she can change the slides, and I'm going to go help this young lady.
Excellent. Thank you.
Okay. Well, good afternoon, everybody. It's a pleasure to be here with you. I say good afternoon. It's afternoon here in PEI, but it could be good morning to wherever you happen to be, or it could also be good evening, as Margaret is in Germany. So today, can everybody hear me okay?
Yes.
Okay. Perfect. Thank you. If you're not able to hear, please just in the audio, the chat box, just let us know that we did have some challenges last time. Jeanette and I have been asked to provide some practical tips around reliable sources of health evidence and to help make your search a little bit easier. Before I begin, I'll just give you a little information about Jeanette and myself. Jeanette is the CADTH Liaison Officer with the Federal Health Programs and the Territory of Nunavut and Canada's Aboriginals people. In this role, Jeanette supports access and promotes the use of evidence in healthcare policy and clinical practices. Prior to joining CADTH in 2005, Jeanette enjoyed a variety of careers that span classical music, education, media and public relations, as well as business communications. So I'm very pleased to be working with Jeanette with you today. My background, I'm the liaison officer for Prince Edward Island and Veterans Affairs Canada, and my background is over 20 years in the medical system as a medical imaging technologist, as well as a lifetime as a military family member. My father, brother, husband, and now my son currently are serving in the Canadian Armed Forces. So I do know firsthand the importance of the military family resource centers to our military families around the world. So I thank you for all the work that you do, and very pleased to be here today. So as I just got a brief outline here to go over what we're going to cover today. We'll show you where to find some evidence, as well as where to locate critical appraisal tools for both newcomers and experts alike. And these tools will help you determine whether or not evidence you found is trustworthy and appropriate for your needs. And we'll end our presentation today with a few suggestions of what you can do if you're considering introducing a new program that has yet to be studied or has little evidence to support what you're looking at doing. So we'll give you some tips and tricks about where to search for evidence. We'll provide you with some resources to support your evaluation of that evidence, and we'll give you some options to know where to go when evidence isn't quite what you thought it should be. Over the next several slides, we'll share some lists of different resources that are recognized worldwide as being among the most reliable. And for some, we've produced some screenshots or two to help share sort of the search or how to navigate them, as each website has some unique nuances to it. And if you have any questions as we go along, by all means, please don't hesitate to post your questions in the chat box. Jeanette and I also will be shifting back and forth between the slides. So again, if you have any problems hearing us, please let us know. So we begin today just to touch base with CADTH and Cochrane. These are two ideal sources of evidence specifically for systematic reviews, which are documents that collect and synthesize as well as analyze all the reliable research on a specific single topic. At CADTH, we produce a broad range of evidence reviews, all of which are posted free on our website. And the second link underneath CADTH.ca is a link specifically to some of our resources and tools that our health librarians have created to keep research or lit reviews, the searches shorter. And we'll take a look at the website and those resources in a moment. And I just want to add, in regards to the Cochrane database, we touched base on this last presentation as well. Cochrane is an international organization founded about 25 years ago. It has volunteer authors that produce systematic reviews of primary research following a standardized protocol. Cochrane reviews look at the effects of interventions for prevention and treatment, rehabilitation, and are internationally recognized as highly reliable. Both CADTH and Cochrane provide plain language executive summaries and briefing documents that highlight key findings in their report. The only caveat I'd like to mention in regards to the Cochrane collaboration is that Cochrane reviews, as I mentioned, are often conducted by volunteers and with people that have a personal interest in the topics they're reviewing. So there is a small chance on occasion that these findings may reflect an author's personal bias, but if that happens, it's certainly unintentional, but it's important for us when we're reviewing these documents just to be aware. And the other caveat I'd like to share about Cochrane is that some provinces have to pay a fee to access the documents that are found in Cochrane, and others have access to the full articles. It just depends on what the agreements your organization may have with Cochrane itself. Over to Jeanette.
Thanks, Lisa. So I'm going to begin by taking a look at CADTH's website. We're going to start at home here and give you just a quick tip, a few tips about how to search our website. CADTH has been around for a very long time, and we have a massive number of reports on our website, and we do have quite a number of programs. So finding information that might be specific for military family services, this is the best way to do it. If you go to our homepage, CADTH.ca, we have a nice large search box at the top, and you pop in the keyword that you're looking for in there, and then that will take you to a page that looks somewhat similar to the one you're seeing on the screen now. The best way to narrow down what you're looking for, because if you put in a search word like addictions, you're going to get drugs, you're going to get all sorts of interventions, you're going to get environmental scans, things that really probably aren't useful to you. So go to the right hand or the left hand column to the box called product line that's circled there, and then that will give you this drop down menu. Click on the box that says rapid response. So rapid response, these are our very quick and succinct reports on recent evidence about various interventions. And you'll see that whatever term I searched there, and I apologize, this is one screen where I forget what it was I was searching, but there's an interesting report there about at the bottom called Constraint-Induced Movement Therapy for Children, and this tells you whether or not we're looking at clinical effectiveness and guidelines on the use of this. The one thing about CADTH rapid responses that I should share is that rapid responses are prepared for individual requesters. So this is someone in government, in healthcare, who has a very specific question that they want us to ask. And so our reports vary in the quantity. And I can hear someone doesn't have their line muted, and we can hear you the conversation. Sorry about that. So in some of our rapid response reports, you'll open it up and all you'll see is a literature search, a bibliography of articles with links to anything that's online. That's because that's all the person wanted. This is an individual who wants to read the evidence for themselves and doesn't want any additional assistance. Others of our rapid response reports contain what we call a summary and critical appraisal. So this is where our research officers here at CADTH have gone through all of the full text articles that we've found that are relevant, and they've read the research. They do a critical appraisal to tell you what is the trustworthiness of the particular article, and then a quick summary of the findings based on a fairly rapid review of the evidence. It's not a full systematic review, but it can be extremely helpful in getting you started and in pointing you in the direction. And so then let's move along. Next slide, please, Lisa. Lisa also pointed you to our resources page that our health librarians have put forward. If you go into that page and click on the link for the HTA database Canadian search interface, it will bring you to this page. This database is housed by the University of York in the United Kingdom. It's a database, the York database is massive. It pulls together literature from all over the world. And we find it very useful because it has a lot of valuable information. So our health librarians worked with the people at University of York and asked them to set up an HTA database of Canadian research. So anything that, if you pop a word in this particular website, the results that come up will be research done in Canada for Canadians, so you know you're hitting the Canadian context on this. And so when I popped in the search term addictions, lo and behold, if the first hit wasn't one from CADTH, and this was unintentional, but there you go. If you want to search the entire York database, and it is a very valuable resource, the two circled items there, those are both ways to get into the full database. So either at the bottom, all CRD databases, and then or over on the right-hand side. And next slide, Lisa. The other resource on our CADTH resources page, and that might be valuable for people who are perhaps a little bit more skilled in finding evidence, is the Gray Matters tool that our health librarians came up with. It helps you search for gray literature. Now, gray literature sounds like it's something you might not want to pay much attention to, but nothing could be further from the truth. In the world of health evidence, gray literature simply refers to literature that is not published in a journal. It's everything else. CADTH's reports are gray literature because we don't publish in a journal. We post everything free online. And many government agencies are similar. Health Quality Ontario, NICE in the UK, AHRQ in the US, all very reliable sources of evidence, but their literature is considered gray literature. The Gray Matters tool can help you find that literature. It is large, it's complex, but our librarians have created a guide to help people use Gray Matters, and they are also always very willing to answer people's questions. If you want to use this resource and you're not quite sure how to do it, let Lisa or I know and we'll put you in touch, or if you have a health librarian friend who wants to know how to use this, we can put you in touch with our health librarians. We're always happy to answer questions. Lisa?
Yes, thanks, Jeanette. So Jeanette had mentioned gray literature and the work that CADTH does, and as well she mentioned AHRQ. And these two sites that I have up here, NICE in the UK is a multifaceted organization, and the easiest way to get their evidence is through their search page. And again, it's fairly straightforward. Also, AHRQ, or the Agency for Healthcare Research and Quality, is a rich site that contains clinical information on evidence-based practices, medical effectiveness, pharmaceutical therapies, screenings, and outcomes research. And they also manage the National Guideline Clearinghouse, which again is a very large list. It has a huge range of guidelines from anywhere in the world. And if you can find a guideline in the Guideline Clearinghouse, you can be guaranteed that it's a very good quality. And the other caveat, just like the others, that I'd like to share is NICE serves the UK, and the AHRQ is American, and therefore some of their strategies or recommendations are not always applicable to us here in Canada, but it's certainly a good place to start. As well, from NICE's evidence search, the term gambling, as we put in here, turned up over 628 hits. And the brief description gives key information. You can see there on the side what comes up, and it tells us the date, the type of review that it was there, the link to the summary, and links to other similar evidence or more systematic reviews, which is also very helpful and sometimes quite challenging not to get off sometimes into a different direction when we go into looking at other systematic reviews that are very similar. And again, this is a snapshot of the Agency for Healthcare Research and Quality out of the U.S. And again, here's another sort of the difference in how that search engine shows up, and but you can still see all the topics related to that particular paper and where to find that information. Jeanette, over to you.
Yeah, and just staying with this page for a moment, Lisa, you'll notice that when we searched gambling, the first thing that came up was a guideline, and this, they show you there, also is listed in the National Guideline Clearinghouse. So this, the larger AHRQ search will pull up some of the guidelines. The second circled box there actually says that they suggest you read what they call suggested topics for research. And what this is telling you is that they really don't have a lot of information on gambling, and they really would like you to submit a request. So this particular page that they've linked you to suggests how, or walks people through the process for making a topic suggestion to AHRQ. So it's just a clue that there isn't too much information about gambling on the AHRQ website. Next slide, Lisa. But when you go to the National Guideline Clearinghouse, as Lisa said, there are oodles of guidelines there. I popped in the term family violence to see what they might have as far as guidelines for family violence. And you can see here are two of the top 3 hits. The second one is a really quite interesting one that popped up, and it's from the U.S. Veterans Affairs. U.S. Veterans Affairs, as you may be aware, is very involved in research, and the work they put out is excellent quality. And they, in partnership with the U.S. Department of Defense, have put out clinical practice guidelines for the assessment and management of patients at risk for suicide. The nice thing about this guideline is that it's not just for military and veteran personnel, it's actually applicable to the general population. So if suicide prevention is of interest to your particular organization, this may be something that you might want to look into. I was looking at family violence. Obviously, family violence is mentioned in this report, or it would not have popped up in this particular search. Lisa?
Thank you, Jeanette. Yeah, and the next, again, we've listed some websites here. These 3 sources, again, provide a mix of evidence and information. TRIP is a clinical search engine designed to allow users a quick and friendly way to locate high-quality evidence to support their practice. While it includes high-level evidence from CADTH and Cochrane, it also has other content such as images, videos, patient information leaflets, education courses, and news. And we'll look more closely at TRIP in the next slide here. I also wanted to mention, I can never say this acronym, but the Substance Abuse and Mental Health Services Administration is an agency, again, out of the U.S. Department of Health and Human Services, and its mission is to reduce the impact of substance abuse and mental illness on American communities. In addition to some of the evidence SAMHSA provides, It also provides patient tools and mental health education programs, including downloadable training kits on how to establish a safe and effective peer support program. So it has quite a mixed variety of information and documents to support practice. And the last website I wanted to mention here is the Social Care Online. And this is the UK's largest online database for information on all aspects of social work or social care. And it includes legislation, government documents, practice guidance, as well as research findings and UK grey literature. So books, textbooks, and journal articles are also included. The database is updated daily, but it's quite large, and it contains over 155,000 records from the 1980s onward. So we'll take a closer look at this in a minute, and I will back over to Jeanette.
So this is the TRIP database, and one of the reasons we mention TRIP is because it has a lot of very user-friendly features. You'll notice that when I began, I typed in the search term gambling, and over on the right, it had some other suggestions about how I could narrow down my search. So was I looking for gambling literature? Was I looking for gambling with this under the subset of addictions? Was I looking for anything related to impulsivity? So if you want to narrow your search, they'll suggest what you might want to limit it to. You'll see that when I just did that general search for gambling, 2,970 results came up, and you really don't want to look at all of those. That would be overwhelming. But remember, TRIP includes not just research, but also patient tools and news articles and photographs. And so they have also given us a nice system to help us sort through all that evidence, and I'm going to show you that in a moment. But Lisa, if you could go to the next slide. Before I do get to that system that TRIP shares with us, I wanted to draw your attention to their ability on TRIP to search by PICO. And for those of you who were with us last time, some of you may know, so many of you weren't, but PICO stands for a way of defining a research question. The PICO is your population, your people of interest. So it could be people with diabetes, but that's huge, or it could be people with marital challenges. So you put your keywords in there for your population. Your intervention is how you're going to actually fix that. Why are you going to, is it a drug? Is it some sort of cognitive behavioral therapy? What is the intervention? You put that in there. Your comparators, you can compare it to nothing. You can leave that blank, or you can compare one drug to another drug, one type of psychotherapy to another type of psychotherapy. And then, importantly, what kind of outcomes are you looking for? Are you looking for symptom improvement? Are you looking for a cure? What are you looking for? And that's your outcome that you're searching for. So TRIP gives you the opportunity to narrow your search immediately through a PICO search. Not very many websites do that, so that's why I wanted to point that out. On the next slide, this will give you some insight into how to search through TRIP more efficiently. So I put in the gambling request, and this is part of the screen that popped up in front of me. Over on the right-hand side, this is where you can get a lot of information. So they have color-coded the information in TRIP. Anything that is a systematic review, so in other words, a large report that compiles a huge body of evidence down into a single report. Anything that's a systematic review is coded in green, and that says you're going to get a lot of information. You're going to usually get a very well done study. The information is generally more reliable, and so anything coded green is a go. That's something that may be really helpful and relevant for you. And the other thing that you can do over in that right-hand column is search by a subset of the country. You see that we're second there on the list. You can look for Canadian information that's systematically reviewed. Click on that link, and it will narrow your hits to, how many does it say there are there? I think that says 13 that are available. Anything that is coded in red is primary research. And the reason it's coded red, red sort of means stop, but it says be cautious, because this is just one study. The results may not be reproducible in another context. We're not certain about this research yet. Systematic reviews, we're much more certain about the findings. And so that's kind of where the color coding helps you. So if it's green, it's a go, you're going to be reliable. If it's orange, it means it's somewhere in the middle. And if it's red, be cautious. It doesn't say don't use that evidence, it just means be cautious. The next slide talks about social care online. Now, this, again, it may be a very helpful site, which is why we included it for military family resource centers. And here I popped in a search for family violence. Again, this is another site where you can, they have given you some tools to help you narrow down your search. Over on the right-hand side, it says key to icons. They have given you icons, and this will tell you whether the information is available for free, which can be important, whether the information's in a journal, whether this is a book, or whether it's some sort of other type of information. Over on the left-hand side, you can also filter things down. You can find items that are available for full text for free. You can, again, click specifically into journal articles. When we're looking at family violence, they found 1,400 hits on family violence in journal articles. But below that, you can see publication years. So you can go back and get the most recent evidence, and that's what we like to rely on most at CADTH. Research done back in the 50s and 60s is not done the same way as it is today. We have much tighter parameters, much more rigid protocols, and the research is generally a little bit more reliable. So you can search by publication year, and below that you can scroll down through the result filters, and you can even search by country. So a lot of very valuable information you want to check out. The next slide is one that we would recommend and caution you about with equal strength, and that's open access journals. Open access means that the full text of the articles that you're hoping to locate are available free of charge. And Alberta Health Services on their website have given you some recommendations for open access journals that they would suggest you use. And again, I can hear someone's mic is on. I can hear you chatting, so thank you very much. But some of the open access...
Just one second. Can you just
yes.
please mute your microphones, everybody? Because I do hear some background noise. And welcome. Good. I'm glad you got through. Thank you.
Thank you very much. So open access journals are ones where you can get full text, and they're wonderful, but there is a huge caveat with open access journals. There's an organization called OMICS, and they have gone around and been purchasing some of these open access journals recently. If you're really interested in this, I would advise you to Google CTV News and OMICS, and you will find some recent work that they did investigating OMICS as a predatory publisher publishing junk science. Every day in my inbox, I get 2 or 3 invitations from organizations I've never heard of, addressed to Dear Dr. Jeanette Smith. I'm not a doctor. We invite you to publish your articles in our journal. They do this across the world. They go out and they just try to entice people to publish articles. And why do they do this? Well, because I would pay them a small fee to have my article published by them. So they're obviously going to make money from me. But I'm not a researcher. I could write anything and they would publish it. So I would strongly suggest that if you find an open access journal, including some of these Canadian journals, that you very carefully try to find out who owns the journal. Is it reliable, like the New England Journal of Medicine, or is it some journal that perhaps you haven't heard of before? I would definitely check out to see who owns it, and if it's owned by Omics, I would not necessarily trust the information that's in that article. Lisa.
Thank you, Jeanette. So we've got a few tips and tricks for your search strategies, and Jeanette did make a comment previously about our PICO framework that is commonly used to frame an inquiry or a research search. So, and I won't spend any more time on this, but again, the PICO, is very important to have the powers in the question. So framing it very specifically really does help with your search. So, you know, knowing what your patient population is, the interventions that you're looking to compare, and the outcomes that you're seeking to obtain are all sort of key indicators that will help you refine your search. And again, you know, I made comments there that the power is in the question, and you know, good questions have a narrow scope, and it's very easy to craft a very open question. However, it doesn't. You'll soon learn that it doesn't necessarily help you when you're trying to come to a solution or make a decision. So, you know, some of the questions that is to ask yourself, you know, that we've posed is, you know, what are the clinical effectiveness, what is the effectiveness, and again, narrowing those questions down really keeps your results focused and keeps it from getting too broad, so the evidence won't be overwhelming. And again, here we go to PubMed. This is one of the best known health evidence resources, and it's a database that is huge. It has over 26 million citations. Its home page search tool definitely demonstrates a broad range of topics. However, on the lower of the page, you can see some useful links, again, to, you know, narrow your search. And again, it's very important to, like I said earlier, just to keep your search fairly succinct in order to mitigate huge volumes of information, because sometimes that will just complicate trying to find the right materials to support your work. And again, here are more PubMed references or links that that our health librarians felt were really helpful starting points, and we'll look at the third one more closely in just a moment. This is an example of an article. When we pull up the article from PubMed, you can see from the title that it does provide a great deal of information. This is a systematic review, which is a large summary of evidence. And if there is an abstract, PubMed will provide you with the full text of the abstract, which also is quite helpful. And if the full text of the article is available for free, PubMed will provide a link in the right-hand column. And finally, PubMed will give you suggestions for similar articles that may also be of interest pertaining to that particular topic. Back to you, Jeanette.
So this is the page that you will see when you go into PubMed Clinical Queries. And why am I showing you this? Because it's a really excellent way to narrow down and find some high quality evidence quickly in PubMed. You'll see below the search box 3 separate columns of words: clinical study categories, systematic reviews, and medical genetics. Obviously, we want to ignore medical genetics, but the other 2 columns will be extremely useful to you if you decide to use this particular search tool. So I popped in the word gambling, and on the next slide, we will see what came up under the clinical study category and systematic reviews terms. So here are the bottom two hits. So under the systematic reviews, it shows that a very recent systematic review of cognitive behavior therapy for problem gambling. And the nice thing about this particular search box, it does pull up recent evidence. PubMed has designed some filters in the background that help you get to hopefully the most useful information, and this is one of the ones they pulled up. The one on the left-hand side, personalized behavior feedback for online gamblers. This happens to be an individual, a single study. However, while we promote the concept of systematic reviews, sometimes major studies are so large that they're pretty darn reliable, and this happens to be an example of one of those. The study was done using a total of, first of all, they began with 70,000 potential people that they could study. They narrowed it down to a random selection of about 1,800 people and got in touch with, 18,000 people, excuse me, got in touch with them. And of those 18,000, 5,500 people agreed to participate in this study. And if any of you are into statistics, a study with 10 people and a study with 5,500 people, which one's going to be more reliable? Well, obviously 5,500 people. And basically what they were looking at were some very specific tools for gamblers that they provided to them. These were basically messages that would go into their phones, pop-up messages that would suggest that perhaps they would want to limit their gambling, to question what they were doing. And they actually found with this particular intervention that it worked well. It worked extremely well in comparison with 5 other strategies that they looked at for supporting problem gambling. So this is an example of PubMed helping you find a particular individual study that if this is an issue that you want to tackle, that this particular research might support your decision making and help you figure out what kind of an intervention might work with people. Over to you, Lisa.
Thanks, Jeanette. Well, so we bring up Dr. Google because, truth be told, this is where most of us usually do start searching, including Jeanette and myself, when we go looking for evidence. And, but however, I just want to caution, it is likely the least reliable source of information or evidence anyways ever invented, but we all use it, and it can be helpful if we approach it with caution. And fortunately, we actually have a tool for that. CADTH has produced 2 resources to help people evaluate the credibility of websites. And this particular one is posted on our CADTH website, and it contains a series of questions for you to ask when you found some evidence and you're curious about what's the quality of this evidence, and is there potential for bias? And when we look at the website, why does the website exist? Is it there to share useful information, impart knowledge that is unbiased, or is it there to make money? And is the information objective, based on logical facts and not speculation? But one of the biggest questions to ask is who funds this website, and who are the authors, what is the institution, and who is on that editorial board? Like Jeanette had mentioned earlier, there is, when you peel back the onions on some of these journals, or even journals, there's some gray area about the actual unbiasedness, if you will, of that information, and it's even more so pronounced with websites. And so we have a credibility checklist that we've put forward for folks to help them as an aid to go over the information. And I share this with you today, and if you're interested, we can also share this after if you'd like to have this a copy of this for your own use. But these tools are very useful, and they're quite popular with our other CADTH customers. Jeanette,
so
back to you.
Thank you, Lisa. So once you've found some research, that's wonderful. But whether it's on, you know, PubMed, CADTH, whether it's on the NICE website, the next thing you really need to do once you've found information is to determine its credibility, its accuracy, and its usefulness in your context. And for that, the skill is called critical appraisal. We're going to give you a couple of links to critical appraisal resources and education resources. The National Collaborating Center for Methods and Tools, this is a center funded by the Public Health Agency of Canada, has put out a wonderful compendium of critical appraisal tools. These are for public health, but they are very easily adapted to almost any kind of research. It's a very large set of tools. Critical appraisal tools basically ask three questions always. Are the results of the review or the research valid? That's the first place to start, because if the results aren't valid, if this is something you can't trust, throw the research out. Don't even bother reading any further. If you can't trust it, why waste your time? If you think you can trust the research, then the next question is, what are the results? So look at the findings. And finally, you need to think about, will the results fit into my context? Is this something I can actually use? And those are three really important questions. So critical appraisal tools are created for the almost amateur user of critical appraisal up to the very professional. And here at CADTH, our research officers use a broad spectrum of critical appraisal tools depending on what they're looking at. Critical appraisal tools are created, different ones are created for different types of research. If you're looking at a clinical trial, there are tools for randomized control trials. If you're looking at systematic reviews, you have to appraise those a little bit differently. With clinical practice guidelines, you have to appraise those a little bit differently. So there are different questions to ask and different tools for different types of research. If you want to get into this, and some of you very well may, the first thing you really want to do after you've found a tool is to learn how to use them. And again, the National Collaborating Center for Methods and Tools has done an excellent job of creating some online resources for you. They have created free training sessions on a whole range of topics. I'm going to show them to you in a minute, and you can start there if you're interested. The other thing that you can do is, if one's available in your area, sign up for a CADTH in-person workshop on critical appraisal. And in fact, if you have a group of individuals who want to learn a little bit more about this, get in touch with Lisa and I, and we can help you set something up. CADTH workshops are all available free of charge and upon request. So if you want to learn how to do critical appraisal and you're very keen on this and you think it might help, then get in touch with us. We have liaison officers in almost all jurisdictions in Canada, unfortunately not in Quebec, but pretty much everywhere else. And our colleague liaison officers can work with you to do a critical appraisal session. On the next slide, we see this is the National Collaborating Center for Methods and Tools, and these are their introductory workshops that are available free of charge. And you can do these two ways. One, you can do them for your own personal interest. You don't have to register with NCCMT. You don't have to do anything. You can just work through them at your own pace. But if you want to become certified, you can do that again for free. You just work your way through them. You register first and work your way through them, and they will provide you with some certification. At the end, you can say, I've done this and I have certification. I know how to critically appraise evidence. Lisa, the next slide, please. So here we have, I selected one example of some of the more simple critical appraisal tools that exist. These are the CASP checklists. They're among the most user-friendly, they're free, and they're online. CASP stands for the Critical Appraisal Skills Program, and it's a training organization that's based out of Oxford in the UK. And on this slide, you'll notice that they have the different tools for the different types of research, which I had mentioned. I'm going to show you just the first page of the qualitative checklist. So if we can go to that, please, Lisa. This is what a critical appraisal tool looks like. It's just a series of questions that you should ask after or during your reading of the research to help you decide whether or not you're going to trust it. So here in the qualitative research, the first question is, was there a clear statement of the aims of the research? And one of the things I like about the CASP tools is that they give you some hints about how to think about this. What was the goal of the research? Can you actually say why they did that research? Why was it thought to be important? And is it relevant? So the CASP checklist for qualitative research simply contains 10 questions, and they're all framed this way. You say yes, no, can't tell, and maybe you can make a few notes in the margin as you're going through this, and that will, once you've reached the end, you'll have a pretty good sense of whether or not you can trust the study that you're actually reading. Back to you, Lisa.
Thank you, Jeanette. So we've spoken today about, where to find evidence and how to critically appraise evidence, but what if you put in a search and you can't find evidence? What if there's no evidence? Well, there's things that you can do, and there's things that by conducting an environmental scan to locate others with the experience or knowledge, finding people who may have run a program similar or have in the past, and asking them questions about their experience. What worked, what didn't work, what lessons did they learn, what things would they avoid in the future, and what would they suggest. And the other option is soliciting expert opinion from multiple sources to ensure a well-rounded perspective. And we say from multiple sources because I'm sure we all have been experienced with someone who is very strongly aligned with a certain methodology. And so it is really important to get multiple perspectives from a diversity of opinions in order to form the next steps of, especially when there is no evidence. Back to you, Jeanette.
Thanks, Lisa. The other thing you can do is look at a decision guide or a decision framework. Many organizations that look at policy or clinical practice use a decision guide or a decision framework to ensure that whenever they make a choice, they're always making it based on the same criteria. And the Canadian Forces Health Services has an excellent decision guide, and there are many of them around the world. But the one I wanted to point out to you is a document. It's actually massive, but it can be split down into relevant sections. And it's from AHRQ, and it's called Will It Work Here? A Decision Maker's Guide to Adopting Innovations. If you don't have any evidence, you can't answer all of the questions in the decision guide because some of them are framed around the evidence. But some of the other questions that are not based solely on research evidence, some of those other questions can be really useful in getting your thoughts around whether or not this is something you really want to do. So in this decision guide from AHRQ, the first question that they ask is, does the innovation fit? So innovation, new program, something new. And their advice is that you assess the feasibility of adopting a particular innovation, beginning with an understanding of how the innovation works, the scope of the innovation, and here are the key questions that they say to ask. How does the innovation work? What's the scope? Where has the innovation been implemented? And what evidence is there that this works? Now, the Decision Maker's Guide, you can do it online, on screen, HTML, but they also have a PDF version that's more like a book, and that's the one I actually prefer using. Although it's 100 pages long, some of the pages, the spacing is huge, and there's a single question on a page, and some of the additional information is just guidance about where you can go to think about this more thoroughly. So there's a lot of information there you can ignore and just stick with the major questions, and it might help you with that. Decision guides can help you frame some questions to build a business case, because if you're going to put something forward that has no evidence, military family resources are going to expect you to build a business case. Tell them exactly why you think this should be adopted, and some of these questions will help you in thinking through that business case for developing a request. Next slide, Lisa. In-house trials. Is that me as well? Sorry, there we are, in-house trials. If you build a business case, we would suggest that you, for something that there is no evidence, you really want to do this, we suggest you may want to consider running your own in-house trial. Some organizations call this uptake with evidence development. So in other words, yes, we will fund your program, or we will allow you to, we will give you the money to fund this particular intervention for a limited period of time, as long as you conduct a basic research trial and give us the findings at the end about whether or not this actually works. Clinical trials, research trials can be very complex. They can be challenging, but they can also be simple. You can make them relatively simple. Most important thing to do is to set out your purpose, set out what it is you intend to find and how you intend to measure what you're looking at before you begin your trial. And we've given you a couple of resources. These are just examples of places where you can find more information about setting up a trial and what a trial design looks like. These are not necessarily validated or recommended resource, but the World Health Organization, a pretty good resource, and then Dr. Harvey Liu from UBC. And important thing is establishing an a priori evaluation. How are you going to evaluate this? Tell them what it is you're going to do to evaluate before you actually begin offering a particular program. Lisa?
Thank you, Jeanette. So as we come to a conclusion, I just want to provide a little bit of a summary. In the presentation, we provided quite a number of links, and there's many reliable sources for locating evidence. And, you know, there's a lot of them that are free. And to do a thorough search, it does take time, but there's tips and tools that can help. And with the numerous resources, the critical appraisal bit is very important, and if it's something that you're interested in, by all means, please don't hesitate to connect with Jeanette or myself, and we can arrange to have to put one of these on for you. And the other thing I just want to mention is when and if evidence is lacking, considering taking on the task of developing the evidence. And you know, if it's something that you're looking at bringing forward, chances are there's others as well. And you know, as we go forward in creating evidence, it's part of how we innovate what we do. So I'd like to open the floor to any questions that anybody may have.
And Lisa, just as people are formulating some questions, we should say that there is one source for evidence that we really didn't mention today, and that's CADTH. If you really don't want to do your own literature search, we actually can do that for you free of charge. It's one of the things that CADTH was designed to do. So you can request a rapid response report for us. We do have parameters around what we actually can cover. Our mandate is interventions, basically. So if it's a peer support program for individuals with post-traumatic stress disorder, we can look for the research on that because that's an intervention. Some things fall outside our remit, but if we can answer the question, we will. So that's one thing we can offer. So are there some questions? Perhaps we'll turn it back over to our moderator to help us out with that. Or you can pop your questions.
Or you can put your questions in the chat as well.
Yeah, for sure.
Or if you'd like to grab, if you want to grab a spot on the whiteboard, you can do that with your pointer as well. On the top left-hand side of the screen, you can grab your pointer and then use your text tool to write a question. There's lots of ways to share your questions. You can raise your hand as well. There's a little hand icon in the participant checklist on the right-hand side of your screen. It looks like a mitt.
Looks like Amy raised her hand.
There you go, Amy. Do you have a question? Amy, do you have a question? Write it in the chat.
There we go. Am I on now? I had to find the mute button. Okay.
You're on.
No one else is jumping in, so I'm going to maybe ask a specific question, but I think it might be applicable to other people on the call here. So let's say, for example, because we did see a lot of different websites and there's so many resources. So I'm going to ask a question. I'm curious what website you might direct me to or which resource. So let's say, I mean, I'm in health promotion. So let's say I was looking at an intervention to increase physical activity using some sort of health challenge, because we tend to do a lot of challenges in health promotion, and I'd like to see what kind of evidence it is around the effectiveness of health challenges in increasing physical activity. Is there a particular resource that comes to mind that you might start with?
I would think, it's Jeanette, I would think my first place to start is PubMed, because if there is something in a journal, it will be indexed there, so I would suggest that there might be something there. And yeah, that would be my first starting point for that.
Perfect. Great.
Lisa, do you have any other thoughts?
No, I would have offered the same as well. Yeah.
Okay.
Start there, and then you can see what would come up.
Okay, that's great. I just wasn't sure with so many options where I would start. The other question, you mentioned that health services had a very good decision-making guide. Do you know where that is, or if there's a way to get that sent out to the team? Because I have not seen that, but that would be a great resource.
So, you mean the National Defense, so Canadian Forces Health Services? I can send you the, health. I can just.
Or through Margaret or whichever, that would be awesome.
So their framework, it's a very simple framework, and I can send you some other frameworks as well that there's one we actually have here at CADTH that we use for one of our programs. So yeah, we can send you a small list of decision frameworks. I will take that on as an action item.
Thank you. That was a great presentation. Thank you.
And I see there was a question, will we be sending out the Google credibility check? And yes, we can definitely send that tool to you as well. Is there any other questions?
Did you see the other question? What does CADTH actually stand for?
It stands for the Canadian Agency for Drugs and Technologies in Health. Now, we talk about health technologies, and let me be very clear, we're not talking about IT of any kind or electronic medical records. In the research language, the health research language, a health technology basically means a health intervention. So it's a drug, a diagnostic tool, a device, or an intervention of some sort. So it could be a mental health intervention. It can be cognitive behavioral therapy. That's considered a health technology in our world. So Canadian Agency for Drugs and Technologies in Health.
And that's the shortened name.
Used to be longer.
Lucy adds that she would like to receive the framework for health services.
Yes, we will send those out through. We'll send it to GADA, and GADA can send it out to everyone who's participated, to all of the MFRCs.
Yes, absolutely. And I have a question about Cochrane collaboration, because I tried to search some mental health intervention, and a lot of the ones I was interested in the research, they weren't accessible for free. So it appears that they have like two-tier system at Cochrane.
Yes, and that's unfortunate. As Lisa said, depends on where you are. Cochrane is free in some locations because the governments of a particular province or area have paid a fee to Cochrane, so it's free. But there's other Cochrane information that just is behind their firewalls, and you do have to pay for it. Now, some publications will give you access to a copy of their research for a small fee. It can be as small as $10. It can be as much as $50. So you have to decide whether or not that's something that you really want to take a look at. The other way to get a sense of what might be in a Cochrane report is if you ask CADTH to do a rapid response for you. We will give you some slightly better insight into what was actually in that Cochrane report. We can't share the Cochrane report with you, but we can critically appraise it and pull out some of the elements from the full text.
Oh, that's excellent. Thank you very much. You guys are awesome. We really appreciate your help.
We're happy
to be able to help.
Okay, and if there's no more questions, we'll be on here. And to exit, you just click on the red X at the very top right-hand side of your screen.
Great.
Thank you to everyone for joining us.
Great to be here.
Please, Lisa and Jeanette, if you can just stay on in case anybody has any questions.
Absolutely.
I'll stop the recording now.